If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, is kidney failure common among diabetic people? Answer by Darcy F. Kruger. Manifestations of interminable kidney ailment shift significantly and can incorporate the need to urinate oftentimes, particularly during the evening, swelling of the legs and puffiness around the eyes, hypertension, weariness and shortcoming, loss of craving, sickness and regurgitating, tingling and simple wounding, shortness of breath, headaches, sleep issues, eager legs disorder, chest torment, dying, bone torment, and diminished enthusiasm for sex and erectile brokenness. Treatment of diabetes incorporates control of blood glucose levels, hypertension, and eating regimen, meds to treat edema and weakness, dialysis, or kidney transplant. Controlling blood glucose levels and circulatory strain is the best approach to forestall or defer kidney illness. Snappy Guide. Type 2 diabetes diagnosis, treatment, medication. Sort 2 diabetes diagnosis, treatment, medication. Legitimate nourishment is fundamental for anybody living with diabetes. Control of blood glucose levels is just a single objective of adhering to a good diet. Anticipate individuals with diabetes. An eating regimen for those with diabetes ought to likewise help accomplish and keep up a typical body weight and additionally avert heart and vascular illness, which are difficulties of diabetes. There is no endorsed eating regimen. Get ready for those with diabetes. Or maybe, eating designs are custom fitted to fit a person's needs, timetables, and dietary patterns. A diabetes eating regimen design should likewise be adjusted with the admission of insulin and oral diabetes medicines. When all is said and done, the standards of a solid diabetes eating regimen are the same for everybody. Utilization of an assortment of nourishments including entire grains, natural products, non-fat dairy items, beans, and lean meats or veggie lover substitutes. Poultry and fish is prescribed to accomplish a solid eating regimen. Read more about diabetes and eating routine. The burden of kidney failure. Every year in the United States, more than 100,000 individuals are determined to have kidney disappointment, a genuine condition in which the kidneys neglect to free the group of squanders. Kidney disappointment is the last phase of unending kidney ailment, CKD. Diabetes is the most widely recognized reason for kidney disappointment, representing about 44% of new cases. Notwithstanding, when diabetes is controlled, the ailment can prompt ceaseless kidney illness and kidney disappointment. The vast majority with diabetes don't create incessant kidney illness that is sufficiently extreme to advance to kidney disappointment. Almost 24 million individuals in the United States have diabetes, and about 200,000 individuals are living with kidney disappointment because of diabetes. Individuals with kidney disappointment experience either dialysis, a simulated blood cleaning procedure, or transplantation to get a sound kidney from a benefactor. Generally U.S. subjects who create kidney disappointment are qualified for governmentally subsidized care. In 2009, tend to patients with kidney disappointment cost the United States about $42 billion. Diabetic kidney illness takes numerous years to create. In a few people, the sifting capacity of the kidneys is really higher than typical in the initial couple of years of their diabetes. More than quite a while, individuals who are creating kidney malady will have little measures of the blood protein egg whites start to spill into their pee. This initially phase of interminable kidney sickness is called microalbuminuria. The kidney's filtration work typically stays ordinary amid this period. As the illness advances, more egg white spills into the pee. This stage might be called macroalbuminuria or proteinuria. As the measure of egg whites in the pee builds, the kidney's separating capacity typically starts to drop. The body holds different squanders as filtration falls. As kidney harm creates, circulatory strain regularly ascends also. By and large, kidney harm once in a while happens in the initial 10 years of diabetes, and more often than not 15 to 25 years will go before kidney disappointment happens. For individuals who live with diabetes for over 25 years with no indications of kidney disappointment, the danger of regularly creating it diminishes. Related articles. What happens if you stop using shampoo on your hair for a year? 20 proven health benefits of drinking enough water. 20 scientifically proven benefits of eating eggs every day. 20 proven ways to stay fit without going to a gym. 20 things can happen if you cut down all the sugar in your diet, except fruits, honey. Answer by Benita Ashfur. Question: is kidney failure common among diabetic people? Answer: chronic kidney disease is characterized by the progressive and irreversible loss of kidney function and filtering and eliminating toxins from the blood. Eventually, those affected must undergo dialysis or kidney transplantation to eliminate toxins from their bloodstream. Some people doesn't notice it, but the good thing I found a method that has helped me and my family in those scenarios. You can see it here. It is well known that type 2 diabetes is one of the causes of chronic kidney disease. The nephrologist Ladies Jakob, who has just completed a postdoctoral fellow in Dr. Plotow's laboratory, has proven that the opposite is also true. The researchers highlighted the surprisingly toxic role of urea, a nitrogenous waste product normally filtered by the kidneys and excreted in urine. The study is important because it reveals a link and rather novel mechanism between chronic kidney disease and diabetes. Further studies are required to validate these findings in humans. But if our observations are confirmed, it will mean that patients with non-diabetic chronic kidney disease are at risk of developing diabetes. One might then suggest therapeutic approaches, such as taking antioxidants, which may protect pancreatic beta cells and reduce the risk of developing diabetes.